In this lecture, we are going to cover the individual types of vertebrae, that's the cervical, thoracic, lumbar, and the sacrum, right? We'll also talk about the thoracic cage, specifically the ribs and the sternum or the breastbone. So, starting with the cervical vertebrae, right? The typical features of cervical vertebrae. Since the load suffered by the cervical vertebrae is lighter than that suffered by the more distally located spinal segments, their bodies are correspondingly smaller, right? So their bodies are smaller. The bodies are transverse oval in shape, and their upper and lower surfaces are concave. Each transverse process is characterized by the presence of a hole called the foramen of the transverse process, right? So you can see here is the transverse process, right? And there is a hole, right? So this is the hole I am talking about, right? It's called what? The foramen of the transverse process. Okay. This there will be a series, right, one on top of the other, forming more like a canal, right? So this protects the vertebral artery and the vein that it transmits. The other thing is the tubercle, right? So there is anterior tubercle of the transverse process is called tuberculum anterior, and the posterior tubercle of the transverse process, that's tuberculum posterior, right? So looking at this one on the image, this vertebrae, right? So this is the anterior side and back is the posterior, right? So this one will be the anterior tubercle, tuberculum anterior, and this one will be the posterior, like tuberculum posterior, right? The anterior tubercle of the C6, the sixth cervical vertebra, is enlarged, right, and is called the carotid tubercle. That's tuberculum caroticum. So you can compress the carotid artery against this tubercle and arrest bleeding. Right, so this one is the typical cervical vertebrae, right? So you can see the body here, corpus vertebrae. You can see this one will be the arch, this whole part will be the arch, right? And this part is the lamina of the vertebral arch. It's called lamina arcos vertebrale. Here you can see the foramen on the center here, foramen vertebrale. Again here, the transverse process, I showed you it, right? The processus transversus with a hole inside, typical, right? Foramen processus transverse, foramen processus transverse, right? So orientation, you know, this one is the anterior side and back is the posterior side, right? So it means this view is the superior view, right? So this articular surface of this process is called what? Processus articularis superius, right? Okay. And then on the back here there is this spinous process, and in cervical vertebrae there is a bifurcation, right? There are two, right? Except C6 and C7, right? Okay, so that's the typical cervical vertebrae, right? But there are differences, like if we talk about like C1, C2. Now let's talk about the individual vertebrae, starting with the C1, the atlas, right? So the atlas is no body, and the vertebral foramen that receive the dens is larger, right? So let me zoom in, right? So you are looking at C1, right? So this view is a superior view, and this one is inferior view, right? So let's start with this superior view first, right? So this is the anterior side, right? Arcus anterior, right? There is anterior arch, right? arcus anterior, and on the back you have the posterior arch, arcus posterior. All right, so I told you that this vertebra doesn't have a body, but which structure is like in the carries the weight of the skull, right? So there is a lateral mass called massa lateralis, right? So it's just there in on the place of the what of the body, right? C1 doesn't have the body, right? So this lateral mass, it does have articular surfaces, right? There is this facet on the superior side is called fovea articularis superior, right? So this articulates with the condylar processes, like the condyles of the occipital bone, right? And on the inferior surface, you also have fovea articularis inferior for articulation with the axis, right? This is the atlas, and the C2 is the axis, right? The inner surface of the anterior arch is this depression is called fovea dentis, right? This is for articulation with the dens. Dens belong to C2, right? We'll talk about it in the next slide, right? But you just need to know it's there, the fovea dentis. And of course, like each arch is a tubercle, right? So this I indicated here is the anterior tubercle, tuberculum anterius, and on the posterior side there is tuberculum posterius, right? Okay. Then of course I told you this foramen is big, foramen vertebrale, right? This. Okay. Now let's talk about the second cervical vertebrae called the axis, right? Okay, so the first thing, the first prominent thing is this dens, right? It's called like it's tooth-like, right? So this is the dens. It distinct this vertebrae from the rest of the cervical vertebrae or any other vertebrae, to be more specific. Right. So this dens is articular surfaces, right? You have the facies articularis anterior. Facies articularis anterior. This articulates with the fovea dentis, right? Fovea dentis on C1. And then there's facies articularis posterior, right? This one, there will be a transverse ligament, right? We will talk about the ligaments later, but it's the one which articulates on the with the facies articularis posterior, right? Right, and also this one is C2, right? So C1, how does it articulate with C2? Through facies articularis superior, right? So you can see it here, facies articularis superior, and again here, facies articularis superior. All right. Next, you have the foramen transversarium, right? It's prominent for foramen transversarium, right? Okay. And of course, inferior articular surfaces, facies articularis inferior for articulation with C3, right? Then there is this process, right? Processus articularis inferior, right? Inferior articular process. Okay, so this is C4, right? C4 in general. So let's just go through this, right? So you can see facies articularis inferior. You can see the spinous process, which is bifurcated. You can see the transverse process, processus transversus, with the foramen transversarium, right? There is this foramen of the transverse process, right? And you can see foramen vertebrale, foramen vertebrale. On the again, orientation is very important, right? Spinous process, just to know that it's on the back, right? On the back. So this one will be anterior side. So what I'm indicating here is tuberculum anterius, right? The anterior tubercle. And this one is a tuberculum posterius. Tuberculum posterius. Next, there is C6, right? What's important about C6? I told you, right? The most important thing is tuberculum anterius, the anterior tubercle, right? Is large, is also known as what? The carotid tubercle. So if you want to arrest bleeding, you press the artery against this tubercle, right? You can see it again here on the lateral view, right? So this one is the superior view, of course, and this is the lateral view. You can see the tuberculum anterius. Number 7, C7, vertebra prominence. This vertebra is easily palpated in a living person and is often used as a point of orientation, right? So the most prominent thing is spinous processus spinosus, right? If you look here, you can see the transverse process here, processus transversus, and you can see the notch, right? The superior vertebral notch and inferior vertebral notch, right? So incisura vertebralis superior and incisura vertebralis inferior. You can also see the articular processes, processus articularis inferior and processus articularis superior. Right. Now let's talk about the second group called thoracic vertebrae, right? So just a reminder, cervical vertebrae, how many are they? They are 7. And then thoracic vertebrae, they are 12, right? So how do you differentiate thoracic vertebrae from other vertebrae, right? Specific features. Number 1 is the presence of articular facets for the ribs on the body of each vertebra and on the transverse process, which are called costal facets or fovea costalis. Since the ribs usually articulate with 2 adjoining vertebrae, most vertebral bodies have 2 incomplete or half costal facets, also known as demifacets, right? The first, 10th, 11th, and 12th vertebrae are exceptions, right? They don't have these hemifacets, right? The first thoracic vertebrae, T1, has a complete articular facet on the superior edge of the for the first rib and a half facet on the inferior edge for the second rib, right? Okay, that's T1. It is a complete articular facet on the superior edge for the first rib and a half facet on the inferior edge for the second rib, right? It means T2 is another what is a half on its superior part. So half on T1 plus half on T2 is a complete articular facet for the second rib, right? Okay, the 10th vertebra, T10, is only one half facet on the superior edge for the 10th rib, right? So the 10th vertebra is only half, right? So it's a half combining with the half on the inferior edge of the 9th will form a complete facet for the 10th rib. And the 11th and the 12th vertebrae have a complete facet for articulating with the corresponding ribs, right? So 11th and 12th vertebrae, they have complete facets, right? No hemifacets, right? Right, so that was about the presence of articular facets on the vertebrae, right? That's the first prominent thing about thoracic vertebrae. Number 2, in accordance with the greater weight they bear, the bodies of the thoracic vertebrae are larger than the bodies of the cervical vertebrae, of course. The vertebral foramen. The vertebral foramen of the thoracic vertebrae are circular. The articular process are positioned frontally. The transverse processes are directed laterally and to the back. They have a small articular surface for the articulating with the tubercle of the ribs, which is called transverse costal surface. That's fovea costalis processus transversus, right? The transverse process of the last two vertebrae, thus the 11th and 12th vertebrae, lacks these facets, right? So this transverse costal surface, they are not present. These facets, they are not present in the 11th and 12th thoracic vertebrae. The spinous process of the thoracic vertebrae are long and are inclined sharply downwards, right? So their orientation are like tiles, right? So what's the significance of this? Such direction of the processes limits extension of the spine here, which is a protective accommodation for the heart. Okay, so this is a typical thoracic vertebrae. So this one from T2 to T9, right? I just picked a random one, right? Okay, so let's look at the features, right? So the first thing I told you, the articular facets, right? Fovea articularis superior and fovea articularis inferior. You can see the notch here, incisura vertebralis superior, incisura vertebralis inferior. You can see the processus articularis superior, that's the superior articular process, and you can see it's frontally aligned, right? And the inferior articular processus articularis inferior, right? Here you can see this is the most important thing you will see when we talk about the ribs. Fovea articularis transversalis. Right? This is important for articulating with the tubercle of the rib, right? Okay, and here you can see the spinous process, right? Is more like downwards, right? And this, of course, this whole thing I told you is the transverse process, processus transversus. Okay, now let's talk about the 11th and the 12th thoracic vertebrae. 11th and the 12th thoracic vertebrae. The bodies of these vertebrae have a bean-like shape, which looks like the lumbar vertebrae, right? So you should know that lumbar vertebrae, they are described as bean-shaped. There is only one complete facet on the body for a corresponding rib, right? So facet for the 11th rib is on the 11th thoracic vertebrae, and 12th, same thing. There is no costal facets on the transverse process because the 11th and the 12th ribs have no tubercle, right? So no articulating with the there is no costal facets on the transverse processes because these vertebrae do not articulate with what? Or with the tubercle of the rib. Okay. The spinous process is directed horizontally to the back. And there are two additional processes: the accessory process, processus accessorius, and the mammillary process, processus mammillaris, right? The 11th and the 12th thoracic vertebrae differ from each other in the position of the articular processes, right? So in the 11th vertebra, both the articular processes, the superior and the inferior, are in the frontal plane, right? In the 12th thoracic vertebrae, the superior articular processes are in the frontal plane, whereas the inferior articular processes are in the sagittal plane because they articulate with the superior articular processes of the first lumbar vertebra, which is positioned sagittally, right? So now I have talked about two important things about lumbar. The first is bean shaped. The second is that its articular surfaces are aligned like sagittally, right? Okay, we will talk about them later, right? So this is the T12, right? So you can see the processus articularis inferior, the inferior articular process, right? And it's sagittally. And then processus articularis superior is frontally positioned, right? You can see the costal facet, right? It's only one, fovea costalis, because the rib will articulate at this position, the 12th and the last rib, right? You can also see the additional processes which I talked about, the processus mammillaris, that's mammillary process, and the processus accessorius, that's accessory process. Okay, now let's talk about the lumbar vertebrae, vertebrae lumbalis. The lumbar vertebrae are distinguished by a massive body since they carry weight that is still greater than the bone part of the spine proximal to them, right? So they are bigger than the cervical and the thoracic vertebrae. The bodies of these vertebrae have a bean-like shape, right? I told you about this bean-shaped bodies, right? There are no costal facets on the body and on the transverse processes. Why? Because they don't articulate with the ribs. The spinous process is directed horizontally to the back. The articular processes are in sagittal plane, right? I told you again about this. The lumbar vertebrae also have the accessory and the mammillary processes, right? Okay, so this is a classical L3, right? Right, so here you can see the body is massive, right? A massive body because they carry a lot of weight compared to thoracic and cervical vertebrae, right? If you look here, you can see facies articularis inferior. That's the inferior articular surface. And the processus articularis superior, right? You can see here processus costarius there. Okay, right, so that was the side, it's just the side view, right? So it's here again on the right side, right? So look on the left is the superior view, right? You can see the process, right? Processus costalis, right? You can see the mammillary processus mammillaris. And if you look here, you need to pay more attention here now, right? So if you look here, downward here, you can see the inferior articular processus articularis inferior, and the processus articularis superior, right? So this one is the superior articular process, and this one down there is the inferior articular process. Here you can see the pedicle of the vertebrae, right? Pediculus arcus vertebrae. Okay, now it's time for break. Now let's talk about the sacrum or sacrum, right? In children, the sacral vertebrae are separate bones. They fuse in youth after the 20th year, or around 18 years, right? To form a single bone, the sacrum. This fusion is an adaptation to the considerable load carried by the sacrum because of the upright posture of the human, right? The sacrum is a triangular wedge-shaped bone. It is composed of 5 fused sacral vertebrae. Its inferior part is not weight bearing, therefore is they therefore diminished rapidly in bulk, right? So it's a triangle. Okay, you will see what I mean by saying the inferior part is not that bulk, it's diminished, right? It's like a tip of the pyramid. Okay, right. So right, about what triangular shape and this fusion of vertebrae, those are the most important things, right? Okay, the sacrum provides the strength and stability to the pelvis. That's the first function. And transmit the weight of the body to the pelvic girdle through the sacroiliac joints, right? Another important function, right? They articulate with the sacroiliac joints. That's articulation with the lower limbs. That's cool. Right. The parts of the sacral bone include the following: the base of the sacrum, basis ossis sacri. Okay. Basis ossis sacri. Then the apex of the sacrum, apex ossis sacri, and the two lateral parts of the sacrum, that's partes laterales, right? Okay, right. So we are looking at the anterior surface of the sacrum, right? So here you can see the base, basis ossis sacri, and the apex down there. So you can see the diminishing. The upper part is massive, and then the lower part is like shrinking because it doesn't bear much weight, right? Because the limbs will be here, right? That's where the sacroiliac joint is located, somewhere around here. I will show you in another picture where it's clear, right? But for now, just note the apex down there and the base. And you can see the lateral part, pars lateralis, right? So 1 and 2, right? So plural would be partes laterales, right? And here you can see this wing is called what? Ala sacralis, right? Ala sacralis. Right, you can see also how it articulates with the lumbar, right, through the processus articularis superior, right? So it articulates with the fifth lumbar vertebra using this, right? I didn't tell you how many lumbar vertebrae you have. There are 5. Okay, so one more time. 7 cervical, 12 thoracic, now 5 lumbar, 5 sacral. Okay, let's continue. Here you can see these foramens: foramina sacralia anterior or pelvina, right? Foramina sacralia anterior, pelvica or pelvina, right? It just depends with the text. And you can see here on the where the bodies fuse, right? They form prominent lines called the transverse lines, linea transverse, right? Okay, so this is another view, anterior view, but it's sliced. Let's say at the second sacral vertebrae, right? So in this case, we can clearly see this canal, canalis sacralis, right? You can see on the back, crista sacralis mediana, right? So this will be formed as a result of fusion of the spinal processes, right? Crista sacralis mediana as a result of spinal processes. All right. You have crista sacralis intermedia, and if you look here, there were the foramens which I told you, right? This foramen. So here the upper part is not there, so this whole thing is a foramen, right? It's foramen sacralia dorsale if you are looking at the back, right? If you are looking at the front, you see foramina sacralia pelvina, right? Okay. This is the posterior view, right? On the posterior view, I'm sure you can see crista sacralis mediana again. That's where the transverse processes fused to form what? This crest, right? Crista sacralis median. You can see crista sacralis intermedia here, right? So median is 1, intermedia there are 2, 1, 2 here. And on you can also see crista sacralis lateralis, right? You can see it here, right? Crista sacralis lateralis here and here, right? Crista sacralis lateralis, right? You can see again, this is the superior articular process, right? Processus articularis superior, for articulation with the lumbar vertebrae, right? So both they are processus articularis superior, right? I told you about the articulation with the lower limb, right? So this one is the fascis articularis. That's how it articulates with the what? The iliac joint, the iliac bone, right? So the joint will be sacroiliac joint, sacroiliac, from ilium, right? Fascis articularis. Okay, so here you can see this canal again, canalis sacralis, right? And then the back, on the back, it exit is like a hiatus sacralis, hiatus sacralis. Okay, and the foramens, of course, I told you about this, foramina sacralia dorsalia, right? Okay, this is the superior aspect of the sacrum, right? So again, you can see crista sacralis mediana, and you can see the sacral canal, canalis sacralis, and you can see what did I indicate here? Okay, the superior articular process, right? Processus articularis superior, for articulation with the lumbar, right? I'm sure now you understand, right? You can see the lateral parts, pars lateralis, and the base, basis ossis sacri, right? So here you can see it again in lateral view, right? You can see the lateral view here. You can see crista sacralis mediana, crista sacralis intermedia, crista sacralis lateralis, right? Okay, so it's easy to remember, right? Median, intermediate, and lateral. Here on top here you can see processus articularis superior, right? The superior articular process. And here you can see the foramens which I told you here, foramina sacralia dorsalia here, foramina sacralia dorsalia. Here there is a tuberosity, right? So on this view is clearly pronounced, right? The sacral tuberosity, tuberositas sacralis, right? And on the inferior part, right? So this is the first time I showed you these horns, right? Conua sacralia, right? So these horns, you will see horns on the bone which is at lower level, like lower than the sacrum, right? I will show you. Okay, so if we slice this at a certain level, we will come up with this view, right? So let me just zoom it in, right? Okay, so you can see the sacral canal, this, right? Sacral canal, canalis sacralis. You can see the foramens here, and here. Foramina intervertebralia, right? Foramina intervertebralia. You can see crista sacralis mediana, right? Crista sacralis mediana. Okay, that was about the sacrum, right? So the next one, the last group of vertebrae, right? So, but it's now a bone, right? Because there is fusion in most cases when in adults, right? It's called what? The coccyx, os coccyges, os coccyges. The coccygeal vertebrae coccygiae, are the remnants of the tail and the rudimentary structures fusing at the middle to form a single bone, the coccyx or the tailbone. The first three coccygeal vertebrae consist of bodies only. There are no vertebral arches, right? So these vertebrae, they have no vertebral arches. They have no processes again. The first coccygeal vertebrae is larger than the rest and has on its dorsal surface the two processes which are called coccygeal conure, right? Conure, coccygia. The curvature of the coccyx is more anterior in the male than in females, where the inferior pelvic aperture, thus the pelvic outlet, is larger because it is part of birth canal. Okay, and during old age, I told you about this, the coccyx often fuses with the sacrum. Okay, so you are looking at the coccyx, right? This is the anterior view and this is the posterior view. So you can see the base here, the base of the sacrum in green is actually, that's how it articulates, its articular facet, right? In yellow, you can see the horns, coccygeal conure, and the processes are transverse processes here. And the posterior view, same thing, the coccygeal conure, transverse process, right? Okay, that was about the coccyx. Now let's talk about the thoracic cage or the chest. The thorax or chest is an osteocartilaginous cage, right? Osteocartilaginous, it means it is bony and cartilage, right? That this cage containing and protecting the principal organs of respiration and circulation. It is conical in shape, being narrow above and broad below, right? Like a flask. Not really, something like that. Okay, flattened from the before, right? Backward and long behind than in front, right? So it's flattened from the anterior side going back and then long on the back than in front. Don't worry, I'm going to show you the pictures. Don't worry at all. Right, so the thorax consists of three things, right? The sternum or the breastbone, 12 pairs of ribs, that's costae, 12 thoracic vertebrae, thoracicae, right? We covered the vertebrae, right? Okay, so this is the thoracic cage, right? So you can see the sternum, you can see the 12 pairs of ribs, 12 on the left side and 12 on the right side, and the thoracic vertebrae, right? You can see T12 here going up until T1, right? Okay, so let's start with the sternum, right? So the sternum, also known as the breastbone, has three parts. The manubrium of the sternum, that's manubrium sterni, which is the upper part. The body of the sternum, that's corpus sterni, which is the second and middle part. And the xiphoid processus xiphoideus, which is the lower part, also known as the xiphi-sternum, right? Right, so okay, let's look at the sternum, right? So you can see the manubrium sterni, right? That's the manubrium, and here is the body, corpus sterni, and down you can see the xiphoid processus xiphoideus, right? Between the manubrium sterni and the corpus sterni, right, there is an angle called an angulus sterni or angle of Louis, right? So at this angle is very important in case we want to palpate like the second rib, because at this level it articulates with the second rib, right? And this level corresponds with the intervertebral disc between T4 and T5, right? I will show you in a picture. You will clearly appreciate this concept, right? So on top, you can there is a jugular notch, incisura jugularis, right? Can you find this on yourself and palpate it? Please do it. The incisura jugularis, right? The jugular notch, right? Okay, cool. If you find it, right? You can also see another notch here for articulation with the clavicle, incisura clavicularis, and the notch for articulating with the first rib, incisura costalis prima, right? So this one will be incisura costalis secunda, right? For the second, right? So you can see here the incisura for the third, fourth, and the fifth rib, right? And downwards the sixth and seventh, right? So you see only 7 ribs are articulating with the thorax, with the sternum outcome. You will see this concept. It's very interesting, right? So this is the anterior view, and this one is side view, right? So you can see how it articulates with the clavicle, incisura clavicularis, for the first rib, incisura costalis prima, and this part is the manubrium sterni, and the angle, very important, angle sterni, or the angle of Lowy, right? And the notches for articulation with the ribs, right? Don't worry, you will see them. Okay, so now we have covered what? We have covered the sternum, right? So manubrium sterni, you can see it there, the body of the sternum, the xiphoid process, and the angle of Lowy, right? So if you follow, I told you this is the fourth rib, right? So if you go back, you see that it's almost around the level of T4, right? See, okay, fine. Now let's talk about the ribs. Latin name costae, right? So all the ribs articulate by their posterior ends with the bodies of the thoracic vertebrae. The size and shape of different ribs are closely associated with the shape of the thoracic cage and their location in relation to it. The ribs slope their anterior ends slanting downwards considerably. They increase in length from the first to the seventh rib, and the seventh rib is the longest. Right, so classification of the ribs. They are true ribs, thus costa, right? Coste, not casta. Coste vere. Coste vere. And false ribs. Coste spuriae. Coste spuriae. Right. So what are the true ribs? Right. The first 7 pairs of ribs are called the true ribs because their anterior cartilaginous ends is joined directly to the sternum, right? That's why there were 7 notches on that sternum, right? Now you know. About false ribs. The pairs of ribs from the 8th to the 12th ribs are false ribs. Each of the 8th, 9th, 10th ribs is joined by the cartilage, not attached to the sternum, but to the cartilage of the rib above it, right? Like next above it, right? So it's a very important concept. Okay, so that's from 8 to 10, right? What about 11 and 12? They are very interesting. They are atypical ribs. The anterior ends of the 12th, 11th and 12th pairs of the ribs lies free in the muscles of the posterior abdominal wall, and these false ribs are called floating ribs. They are floating, right? Costae fluctuantes. Costae fluctuantes, right? Okay, so we've covered what? We've covered these ribs. So these are the true ribs from 1 to 7, right? They're also known as uh, vertebrosternal, right? Vertebrosternal ribs. Okay, and these are false ribs, right? Because they are not articulating with the sternum directly, right? And among these false ribs, we can further divide them, right? Look, these are the floating ribs, right? So floating ribs, they are floating, and then you can see the other group, they articulate only with the cartilage, right? These ones, they are called vertebrochondral, because chondr is cartilage, right? Vertebrochondral ribs, right? Okay, now let's talk about the ribs a little bit deeper, right? So the rib is two parts, the bony part and the cartilaginous part, right? So the bony part, os costale, is the longest and posterior part, and this part, or this bony part, belong to long spongy bones. If you remember our classification, long spongy bones, right? The cartilaginous part, cartilago costalis, is the narrower anterior part, which consists of the cartilage, and on the anterior end of the bony part of the false ribs fuses closely with the cartilaginous part, right? Okay, I will show you, right? So if you look here, you see what, the bony part here, let's just use this rib. You see, this one is the bony part, and this is the cartilaginous part, and there's close fusion here. All right. Okay. The bony part of the rib, os costale, right? So it has four very important parts: the head of the rib, caput costae; the neck of the rib, column costae; the tubercle of the rib, tuberculum costae; and the shaft or the body of the rib, corpus costae, right? So this is the typical rib, right? So I just picked the eighth rib, right? So you can see the head here, caput costae, and you can see the column, the neck, column costae, and you can see the body, corpus costae, right? And on the inferior margin, okay, I will tell you, like for now, you need to know that ribs, typical ribs, usually they have surfaces like the internal surface and the posterior surface, which you can see here, and the superior margin and the inferior margin, right? Typical ribs, of course. I will tell you about atypical later, right? So on the inferior edge, you find this groove, sulcus costae, for the vessels and nerves, right? Sulcus costae, right? This is the fasces articularis capitis costae, right? It's the articular surface of the head of the rib, right, for articulating with the what? With the sternum, right? Okay. This again here is just the posterior view, right? So on the posterior view, I'm sure you can appreciate the crest, because like on the head, right, at the articular point, there is a crest. There is we call it a ridge, right? Yeah, cool, ridge, crista capitis costae, you find it there. And there is, here you can see fasces articularis tuberculi costae, right? That's how it articulates with the tubercle, the right. But firstly, here you cannot see this concept, but in like typical ribs, on the neck there is a crest, right? It's called crista column costae, right? There's a crest here also, right? Okay, but don't worry about that, right? Because this is more of a posterior view, right? So on the posterior side, that's or the only way you can see the angle, right? The angulus costae, right? And of course the shaft or the board, corpus costae, right? Okay, now let's talk about the atypical ribs. That's first, second, 10th, 11th, and 12th ribs, right? So these ones, they differ from other ribs in shape, right? Let's look at the first rib. The first rib is the broadest and most curved of all the ribs. It is also the shortest of the true ribs, right? So these are the most important characteristics of the first rib, right? It is the superior and inferior surfaces, right? It is superior and inferior surface. And then it is external and internal border, right? So I told you typical ribs have superior and inferior margins and internal and external surfaces, right? So like two opposite things. How cool is that? Okay, let me show you like here, right? So uh, this rib is the third one, right? You can see on top it's like a margin, right? That's the superior margin. Okay, and then inferiorly you see the inferior margin. But if you look on the first one, you see that it is a surface on top, is a flat surface, right? And then internal margin or internal border, and then external border or external margin, right? Cool. The angle and the tubercle of the first ribs, they coincide, right? So the angle and tubercle coincide in the first rib. The articular facet on the head of the first rib does not have a separating ridge. That crest is not there in the first. And the first ribs lacks the crest of the neck of the rib, right? And another crest on the what? Neck is not there. The first rib is clinically important because so many structures cross or attach to it, right? Okay, let's look let's look at the first rib, right? So this is the first rib, right? This is the first rib. You can see the caput costae, the head of the rib, and you can see the tuberculum costae, and you can see the internal margin or the internal border and the external margin or the external border, right? So this is the superior surface, right? So this surface is very important grooves, right? So the first one is called sulcus arteriae subclavian, right? Why is this important? That's where the subclavian artery lodges in, right? And you can see another one here down here. Is called sulcus venae subclavian. That's where the subclavian vein lodges in, right? And between those two, there is a tubercle, right? It's called what? Tuberculum musculi scaleni anteriors, right? This tuberculum musculus scaleni anterioris, right, is for the attachment of the musculus scalenus anterior, right, the anterior scalenus muscle, right? Okay, that was about the first rib. Now the second rib. The second rib is thinner, much less curved, and is about twice as long as the first rib, right? It can easily be distinguished from the first rib by the presence of a broad and rough prominence, which is called the tuberosity of the serratus anterior muscle. That's tuberculum musculus serrati anterioris, right? Okay, let me show you this tuberosity, right? This one. right? So this one is the second rib. Okay, something happened. Okay, so here, tuberositas musculi serrati anterioris, right? And you can also see that it's long and less curved, right? Okay. And on this one, you can see the crest, which I was talking about on the neck, crista coli coste, right? Not crista colam coste, as I said before. Crista coli coste, right? The 11th and the 12th ribs. These ribs are short, especially the 12th pair. And the 12th pair, the latter, may be shorter than even the first rib, right? The 11th and the 12th ribs do not have the tubercle of the rib because they do not articulate with the transverse process of the last thoracic vertebrae. The 11th rib has an ill-defined angle and a shallow costal groove, right? If you compare with the 12th has neither of these features. It doesn't have this angle or a shallow costal groove, right? Okay. The 11th and the 12th ribs articulate with the body only of one vertebrae. Therefore, it has a single facet on its head, right? Right, so you can see here, don't worry about this. We covered this already. It's just a typical rib posterior view. We covered it. I want you to focus on the 12th rib, right? So you can see a caput costae, right? And you can see the articular surface, right? Facies articularis capitis costae, right? You can see the body, right? Corpus costae. And although it doesn't articulate with the sternum, the cartilage is still there. Cartilago costalis. Okay. Now we have covered the whole thing, right? We've covered the whole thing. We covered the sternum, covered the ribs, and we already covered the thoracic vertebrae, right? So this view is just let's say at the level of T4, right? So if you slice it, you see something like this, right? So let's start from the anterior side. So here you can see the body of the sternum, corpus sterni, right? And on the sternum, you can see this angle is called incisura costalis, right? And going to the left, okay, left of the patient, that's what I mean. Okay, so you can see the cartilago costalis, the cartilaginous part of the rib, and this will be the bony part. And towards the back here, you can see the angle, angulus costae, right? And here, look at the tubercle of the rib, tuberculum costae, and the its articulation with the what processus transversus, right? It's clear there. On the back, you can see the spinous process. Right, digging deeper into this joint, you can see the fovea costalis transversalis and the facies articularis tuberculi costae, right, forming this important joint, right. Here you can see the neck, column costae, right. Okay, and of course the foramen, very important, carrying what does it carry? The spinal cord. Okay, so thank you so much. Thank you for your watching this video. If you enjoyed it, please make sure you subscribe and share with your friends, right? So this next part, the end, just test yourself, test your knowledge, right?